Thank you so much, Dr. Lal, Mr. Anand, and Antony, and also Mr. Prashant. Thank you so much for your time. This is a unique panel in a sense because in the diagnostic space we are having leading players, actually those who have been the stellar models in brick and mortar, as well as those who are in the digital space, and each is a known brand in their own right, actually. So I would want to get a sense about, there's a lot which has been happening in the diagnostic space. I mean, there has always been the competition in terms of pricing. मेरा blood test कितने में होता है, कहाँ पे होगा, कितने में होगा, all sorts of questions, and that has been there for years actually. Earlier it used to be between small labs and the hospitals, and then later chains came, and then there's now chains, and now there is the digital players also. So the landscape has been constantly evolving, changing. So first, if you could begin with the perspective from each of the leaders here about their own perception of what they're seeing the change. So Dr. Lal, if we can begin with you in terms of how your reading is of the change.
Good afternoon, ladies and gentlemen. I would first like to thank the Financial Express and the Indian Express group of newspapers, especially Mr. Roshan Pawaiya, editor, and Mr. Kumar Sharma, deputy editor, for inviting me to this panel discussion. So in this era of the fourth industrial so-called revolution, healthcare is also progressively advancing on technical agenda, and the technologies like artificial intelligence, machine learning, big data, Internet of Things have evolved from being a futuristic prospect to becoming actually now the backbone of the new age healthcare delivery. While healthcare is traditionally known to be slow on adoption of digital technology, the COVID-19 pandemic accelerated digital adoption, resulting in significant transformation in healthcare delivery within a short span of time. And in the last 3 years, we have experienced the vital role that digital technologies can and should play in the healthcare revolution. So in modern evidence-based medicine, 70% of all clinical decisions, as you know, are based on lab tests or pathology tests. And pioneering technologies can not only detect presence of diseases, they are integral in detecting the risk of the disease, predicting how the disease may progress, and enabling the right treatment decision for each patient. As you know, medicine is now becoming much more and more personalized. So digital software solutions are now available that support these pioneering technologies by recording, analyzing, utilizing of data for decision making, and that holds true potential for the future of the entire diagnostics. On an individual level, digital health softwares are empowering patients to gain control of their health through mobile apps, fitness trackers, wearable devices, and sensors. The disease burden in India has shifted, and now more than 65% of deaths in India are now attributed to non-communicable diseases or lifestyle diseases or chronic diseases. And Kumar will also be talking about the communicable diseases, as you know that India has a dual burden of disease. As mortality and morbidity associated with NCDs is largely preventable, so early diagnosis and timely intervention hold the key to reducing the burden of NCDs, which also has a huge economic impact, and 2% of our GDP is dependent on this. Just imagine if you were able to control NCDs, the country would be richer by 2% of its GDP. The adoption of telemedicine also witnessed an unprecedented growth during the pandemic, and from teleconsultations for routine and OPD care to managing eICUs, digital technology also showcased how it can address the challenges associated with access to quality healthcare. This is especially relevant for a country like India, given our vast population and geographic spread and socio-economic divide. The government's own telemedicine platform, eSanjeevani, which I'm sure all of you have heard about, has crossed a milestone of 9 crore teleconsultations. But in many parts of the country, especially in the so-called Bimaru states, and states like Uttarakhand, Chhattisgarh, Jharkhand in the northeast, there is a severe shortage of doctors, both GDMOs and specialists, to provide these teleconsultations. So the buck stops somewhere, we don't know where. We have shortage of 10 lakh doctors in India, and even if you go full digital and teleconsultations, even there you have a shortage. The government needs to develop a cadre of telemedicine doctors by involving all medical colleges and district hospitals and creating a special post for this purpose, which could be known as a GDMO or an assistant professor telemedicine, and this could be the junior most faculty member. You will have to do it because nobody is owning up in medical colleges now. Telemedicine, along with better management of healthcare, is capable of addressing India's most pressing needs in primary healthcare. But to enable that, we must address the shortage of both the healthcare professionals and the management issue, which we shall talk about later. A strategy needs to be developed by a management institute. And I'm very firm on this, that in India we don't lack the knowledge, we have the gyan, but the implementation is absolutely missing, and because of the management is not there, or what should be there is not there. So we have been in FICCI, in which I am a chairperson of the Primary Health Committee. We have our partners as IIM Ahmedabad, and they have always offered us that please take our help in whatever you think is a management issue at the primary healthcare level. And historically also this was done by the WHO way back in mid-70s, wherein large number of MBBS doctors were recruited, though temporarily, specifically for the project of smallpox eradication. An extension of use of telemedicine can be for training of healthcare professionals, especially MBBS doctors, to train them to become disease-specific specialists by what we call by telementoring. A case in point is the control of hepatitis C infection in Punjab, wherein PGI Chandigarh used the telementoring platform of ECHO to train MBBS doctors to better manage hepatitis C endemic brought on by indiscriminate drug use, as you all know. This needs to be scaled up manifold for other high incidence diseases, NCDs, like diabetes, hypertension, ischemic heart disease, cancers, and many other NCDs. Additionally, to implement digital health solutions successfully, a multi-sectoral action is warranted on, number one, the availability of IT infrastructure and last mile internet connectivity, which is largely missing on the ground in majority of far-flung areas. Lots of things have happened, but they haven't happened the way we want them to. A digital ecosystem that connects diverse data resources, application devices and technologies, enabling them to work seamlessly. And last but not the least, better governance, which I have already touched upon, better management of health services. It is not a doctor's job to keep managing the entire health services. You have to have specialist trained management experts there. The essence of digital disruption or transformation lies in taking the digital initiatives to the grassroots level, where they can be of real game changers. So I think I'll stop here, and we'll wait for Mr. Kumar to have his questions. Thank you.
Thank you, Dr. Arvind. This was, I think, fairly exhaustive one. I think not just from the way you look at the digital health shaping up, and also about the government's role and adoption of digital technology, the current imperatives for them. I think it covers a bit of all of that. Mr. Anand, purely from the perspective of the diagnostic chains, what is your reading of how the landscape is changed? I mean, where do you see as the key disruption which has happened, and how will it, what's the future that you're seeing over the next few years?
Thank you, Mr. Sharma, for this opportunity, and very good afternoon to all of you. I think Dr. Lal covered all the aspects comprehensively, but if we specifically talk about what actually has happened to the industry landscape post-COVID, so I would like to touch upon briefly upon 2 or 3 aspects. One I would say is, consumerization and digitalization of healthcare. So that's where, specifically we have seen big changes happening post-COVID. So the consumer is more aware. So they now know, they have to look for accredited laboratories. So accreditations like NABL, CAP have become more common for people to know. So there's an activism and awareness around it, so which helps actually to build quality as one of the key aspects of laboratory care. Otherwise, it was just like, whatever is convenient, whatever is available in the neighborhood was chosen. So the next aspect is digitalization. So as we saw during COVID, how the digital reports were used, how QR codes were used. So multiple reference points have been used to create reports, view reports. Home visits were booked through apps. So the use of various digital technologies, has become imperative and so common now in the laboratory space that all players, whether they are omni-channel players or pure digital players, everybody has to have their own digital ecosystem in place where they are able to control and enhance the experience of the digital journey that the patient goes through. So I think that's another important change. Inside the industry, if you see, an aspect that we are all seeing now is the decentralization of testing. So earlier the concept was that we need to have a central lab, and we'll have a hub and spoke model. So we'll have smaller stat labs around the country, and then we'll be able to bring all the samples either to Delhi or to Mumbai or to Bangalore or wherever the central lab of that particular company is. But now what we are seeing is more and more decentralization of services are happening. More regional requirements of turnaround times have been quite, much higher than what it was earlier. So what we now see is that more and more labs have to decentralize their services and set up, regional reference laboratories across the country. So that is another important aspect. So along with this also comes that the focus on the personalized medicine, and for personalized medicine what you need is precision diagnostics. So naturally the omics, whole gamut of services like genomics, proteomics, metabolomics, all these aspects also come to play. And these next generation diagnostics are going to play a very important role, and that we are seeing that the maximum growth also comes from these aspects today. So the next factor is the use of AI and ML in laboratory diagnostics. So we are also seeing that apart from just having a digital pathology network, which all major laboratories now have, the labs are now adapting newer technologies like artificial intelligence and machine learning to improve the aspects of diagnostics, as well as providing second opinion services, remote pathology services. So these aspects have also been sort of fast-tracked as we see overall digital transformation getting fast-tracked. So I think these are the key aspects that I would like to say from my side. Thank you.
Yeah, thanks so much. And you've been so very politically correct and decent. There's one thing about leaders in corporate world. They're so nice to each other when they are on the dais actually. And they have been doing that here as well. Before I come to Mr. Antony, I just want to check with Mr. Prashant Tandon at Tata 1mg. Mr. Prashant, I remember the day when there was an ad put out ki 100 rupees mein sab test ho jayenge. It became a celebration actually in some sense. It was widely, there was, Dr. Velu Mani, so many others you would have seen also tweeted and mentioned and all of that. There was a question that said that this 100 rupees is not enough even for a phlebotomist's salary and you getting the test done. So were you disrupting the market at that time, or was it, you think, a thing which can be sustained?
So, see, I think what COVID taught all of us was that there are huge potential economies of scale, and it's a learning process. And the COVID test, if you remember, 4,500, 5,000 is where it started. 250, 299 is where it stabilized. But the primary thing was actually scale. The number of customers that were then the market expansion. And we hold a belief that the diagnostics market is a very interesting market. It typically people look at it as wellness and curative as the two segments, but we are looking at what we believe is a much larger segment. I'm sure all of us are looking at that, which is the undiagnosed and underdiagnosed, which is a lot of people who just don't know what's going on with them. And we wanted to test in various situations if price is taken out of the equation, does the scale dynamic, does it play out, and do the economics play out? And it turns out at a certain scale they do play out. So having said that, it'll be an evolution and learning model. The idea is not to undercut price and sell at a loss. The idea is to learn the scale at which we can actually go to the masses in a much bigger way, assuming we have the right model of scaling and the right pricing for that. So is it possible? It definitely is what I believe, to bring down the prices significantly for a lot of tests, as long as you are operating at a very high level of capacity utilization, efficiency, etc., etc. So I think we'll continue to do a lot of experiments and continue to learn, and that to me is one of the power of the digital platform, that it just enables, data is there for everyone to learn from, analyze, and create the right model for sustainability. So I think that's what we are looking at, and as a company we really believe that there's a much larger market just waiting to get on, or that needs to get diagnosed, and that is not yet trying it out. And from our limited experience during those campaigns, it turned out a lot more people got tested than they normally do. So at least on the with the consumerization happening, people are very receptive to the idea, and price is still a deterrent. As those deterrents go away, as scale improves, efficiencies improve, we will see new models or more disruptive pricing continue to happen case to case.
I see. So when you say you will continue to do experiments, means we should be ready for more ads.
You will keep seeing wherever we see an opportunity and economies of efficiency and scale possible, we will continue to do those. And you will see, we will advertise, of course. So.
Okay, no, that's very nice actually. I want to come to one more point about you touched upon the point of wellness and curative and undiagnosed and diagnosed. I'll come to you on that. But before that, Mr. Antony, at Apollo 24/7, I mean, we discussed the point of a while ago that in this space, of course, you have a huge presence in pharmacy. But in the diagnostic space, Apollo, being a known brand, has been a relatively late entrant. What do you see as, strengths at this juncture when the market is so competitive, to leverage the brand not in the geographies where you're there, but to get to the India far and beyond, where even Apollo in its, the Apollo, the smaller avatars that they wanted to get into smaller towns and cities, they were not been able to do it. How you plan to actually expand your footprint leveraging on the Apollo brand?
Yes. Yeah, as you know, Apollo has been in this business for close to 40 years and operates in different parts of the world, different parts of India as well as in some other parts of the world. But, in terms of the offering, and I see the differentiator, at least the one which we are pursuing and which we've done successfully over the last 2 years, is we look at it as not just as a diagnostics business. We're looking at it at how do we offer a continuum of healthcare service to our customer. So it's right from a consultation to a diagnostic, to a pharmacy, to an in-person consultation, and if required, a hospital admit. So what we are offering is, and the space which I occupy in Apollo 24/7 is, how do we, through the health tech platform, eHealth, how do we give what was originally a offline business, how do we bring it into this e-space and offer a continuum of care to the extent we can, right? So it's all connected. For example, somebody's consulted a doctor, then you press on a couple of buttons, you've got an opportunity to get your phlebotomist home in 2 hours, finish the consult, then the doctor's back, press another button, the pharmacy can be at home in 2 hours, right? And if required, you can book a physical consult. So whilst the footprint of the Apollo group in different forms of the physical establishment, be it the large hospitals or the small hospitals or the clinics or the diagnostic centers or the pharmacies, they are expanding the footprint. As you may know, for example, the pharmacies are doing about almost 1.5 to 2 new pharmacies a day. That's the expansion. Diagnostics too, today we are, I think, in close to about 1,800 pin codes, and that's on a very fast expansion. So while the physical, it has to be an omni-channel play for us, and that's what we believe is the future. Yes, there has been physical, there has been digital, but we believe that omni is the best way to go, where you can offer both online and offline, and that's what people require in this country. The physical footprint of the Apollo group is expanding as we speak across all of these verticals. The eHealth platform Apollo 247 is available across India. Yes, as there's physical infrastructure on diagnostics in particular, which you said increases doubles in the next 3 to 4 years. You're going to cater to a larger population. So we believe that it's an omni-channel play. So there is an investment going both on the digital side as well as on the physical side.
Yeah. No, I get the point actually, and the overriding theme of the nub of my question really was around growth, strategy to growth, on growth. So when you are talking in terms of expansion here, using the Apollo network here, say for a year, if a year from now, let's say, we were to have a conversation like this, what is the picture you can give of, and very briefly, if you can just give a picture of what will be your presence, in terms of when you say omni-channel also. So like in terms of current footprint versus say a year from now, what's the kind of picture you're giving when you talk of growth?
In diagnostics or in eHealth?
Diagnostics largely because all are here.
Yes.
But overall also if you can.
Yeah, see, diagnostics is one thing which will hugely depend on your physical footprint because of the collection centers and labs. So a lot will depend on what Apollo Diagnostics and Apollo Clinics expand. They do have a pretty aggressive thing. I don't have the numbers offhand, but we have a growth of at least 20-30% CAGR over the next 5 years.
Okay. Dr. Lal, this in this environment, when the question is around expansion and growth, you have done a major acquisition in Western India, and now you're in this competitive environment, you're actually trying to integrate a major acquisition. So what does it take at this juncture actually to integrate, and what's your appetite in terms of growth now?
So, Kumar, the answer is that India is a country now which is now world's leader in population, 140 crores. So, we are talking about Dr. Lal PathLabs, which is, a 74-year-old company, and if I may say so, the biggest in pathology industry. There are 3 lakh labs in India, and we are supposed to be the leaders. So what has happened is that, we started from, say, North India, from Delhi, and then we went to the rest of North India, Central India, East India. So it was but natural that, we would go also into West India. And make no mistake, we have been in Bombay since, I think, late 90s. And we were expanding in our own way till this, opportunity came across. And I can assure you that the world over, all the biggest of the pathology labs, they have also had a very large share of inorganic growth, which is, mergers and acquisitions. So it is no surprise to anybody sitting here at least that, it was a question of time. And one of our other, peers in this thing, they also acquired a lab in Chennai, one year before us. So it's a question of time that this consolidation has to take place. You look at it from our point of view. It not only gets you into an unknown territory, or where you were not very well known, I should say, it also gives you a chance to consolidate. 3 lakh laboratories, only 7,000 pathologists. How are you going to run the diagnostic services in India? So unless you consolidate, there is no other way out. So that's the way we look at it, and it was a major acquisition and cost us 950 crores nearly, but it is well worth it. Thank you.
Okay. Mr. Anand, 950 crores was a big budget thing, but as Dr. Lal says, consolidation is the way forward. So your approach to the expansion of your footprint or growth?
Yeah, thanks, Kumar. I agree with Dr. Lal. So see, this industry is highly fragmented. So as we all know, only 16% is with the organized, so-called organized players. So as 300,000 laboratories, most of them are either family-run businesses or one-man shows. So there is a huge room for consolidation, and mergers and acquisitions are happening every day. And small acquisitions, larger acquisitions, and we are also involved in them. If you actually see during the same period, about in April 2022, we actually acquired 50% balance stake in our joint venture in Kerala, DDRC SRL. So we have also done that acquisition during that same year. So I think all the three major players had done that acquisition in 2022. We continue to scout for opportunities, both large and small, and that is also a very important aspect of our expansion. Apart from adding more collection centers to our existing laboratories, as well as looking at hospital lab management models on other asset-light models that are there prevalent with us. I think that's what I would like to say. Thank you.
Yeah. Mr. Prashant, again now, since the focus is again largely on digital health, and you mentioned this point earlier about wellness and also illness. Wellness still in the growth strategy for you has been a major component. Do you see that ultimately the digital players will be more dominant in the wellness segment, whereas the illness and where emergency care, where doctors prescribe, will be more towards established brands in diagnostics, and not how much of that you see influencing growth?
See, the wellness part is where the consumer is directly deciding, I want to get tested, I want to get some tests, and they go to the channel or the mode or the brand that they trust the most, or they find the most appropriate for their use case. And I think that does flow onto the curative side as well. So once the doctor has written a prescription, we are seeing more and more consumerization of healthcare, where the consumer is deciding for themselves what is the brand that they trust, what is the mode that they find works for them best, and they go there. So I think as the market evolves further, we'll see more and more consumers with right now I think it's around 60-65% wellness for us, or rather what is called wellness, which is people buying preventive health packages vis-a-vis coming with prescriptions. But there's still a very healthy 35-40% of prescription generated or prescriptions coming to us for the tests. At the end of the day, it will be the consumers will have a lot of options. They will pick the option and the channel that they are most comfortable with. And the consumer is not a monolith. All kinds of consumers are there. Certain kind of consumers will choose what we are offering, certain will not. So
which is one point here. When you mentioned that about they will choose the model, you have also arrangement with established players, including some who are sitting here as well. So is that an opportunity or is it a challenge? Because see, you are in some sense working with your competitor. But how will that pan out?
Yeah, see, the way we see it is we want to serve the consumer, and whatever the consumer needs, we like to provide that on our platform. And if it is an offering we provide directly, that's also fine. If it is a partner, we've grown up with a partner network. So I think all key top brands of the country, and the consumers actually are very clear about what they want, and we are perfectly fine with it. If the consumer wants a partner network brand to do the test for them, and they like us to just provide the home collection service and the digital experience, that's worked perfectly fine for us. So I think in that sense, we take a very consumer-centric view of the world. Whatever the consumer needs, if we can, we'll provide. Of course, then we have our own lab team, which is trying its best to make sure that their offering is what the consumer is choosing, but otherwise the platform as such doesn't really decide for the consumer.
Just last 2 points actually. Mr. Antony, you mentioned while we were in conversation a little earlier about how, since you have experience in the insurance segment as well, how the insurance industry is actually looking at e-health. So if you can just elaborate on.
Yes, I think that's a very important area for this entire healthcare and the diagnostics. So as I see it from an insurance company's point of view, there are 3 categories of people who are insured with them: the healthy, at risk, and the chronics. And in my opinion, all of these categories require either a preventive or a curative. And to me, I see a lot more attention in the last couple of years from insurance companies, particularly health insurance companies, to go down the route of offering a sort of outpatient services which wasn't really available through insurance companies in the past, tying it up with various providers and encouraging their customers to use these facilities, particularly for diagnostics or consultations, etc. And they have various schemes. I also see a lot of these companies building electronic platforms which could be on their app, it could be otherwise, to make it very customer friendly and easy for them to trigger these requirements and actually execute on them. I also see health insurance companies and general insurance companies involved in health insurance actually paying a lot more attention in the last couple of years to see if they could construct a cost-effective outpatient plan which includes diagnostics and e-health, right? So there's lots happening on the insurance space. That space is growing. Today as we speak, we have somewhere in the region of 700 and 800 million people. Yes, bulk of them are covered by government schemes, but the people who can afford individual schemes are improving. And I see more and more insurance policies encouraging or having features which allow individuals to go for checkups through diagnostic centers. And I can tell you now, I'm not sure if people in this room know, if you have, I think the majority of the people in this room having a retail health insurance may not even know that they have a free diagnostic checkup every year. It's there in the policy. You can actually use it and insurance companies want you to use it for preventive. Because the last thing they want is for you to go into a hospital. It's not good for you, it's not good for them. So these are already there, but I think they're going to be much more marketed and much awareness is going to be created, and you're going to see a lot of insured players using e-health, particularly for diagnostics.
Yeah. My last point actually, and I would want just a minute from each of you on 2 points. One is now often on we see of these infectious diseases. Now Dr. Lal referred to NCDs. 60% of deaths in India happen because of NCDs. NCDs is a big problem. Non-communicable diseases for our audience: stroke, cancer, hypertension, diabetes, all of that. But infectious diseases also. You have new variant of COVID coming off, suddenly emerging. You have a monkeypox emerging. There are different things. So as diagnostic center chains, do we have now need for a strategy in terms of how, when we have disruptions like this, these infectious diseases keep coming in, what is it in terms of, do we have to develop our own tests? What should be our approach on a long-term basis? A quick point from each of you. And my last point will be on prices. This sector is going to, despite the technology and the e-health component, there has been now a lot of disruption in prices. Are the prices at the current level the right, or do we see actual further reduction in prices? What's the individual perception on these 2 points? Very briefly, each of you, and we'll conclude with that.
So the infectious diseases in India have never actually left us. And the case in point these days was dengue fever. Tuberculosis is still the #1 infectious disease in India, killing almost 1 patient per minute.
Every two patients every 3 minutes.
2 patients every 3 minutes. It's now become less than. So that's an encouraging point. The fact I want to emphasize is that the NCDs are killing 66% of everybody, of the population. And the infectious diseases about 33%, or there may be a road accident,
What
etc.,
should be the
etc.
diagnostics players?
So the diagnostics players, you see, everybody jumped onto the COVID bandwagon because this was a pandemic. And you had to, the policy itself said, test, track, and treat. So you had to start from testing. So everybody, people who had not even heard the word pathology, they jumped onto the bandwagon, established these labs, etc., which are of course ICMR approved. And quietly after the COVID has gone on, many of them have, even wound up. Question is, what you are asking is that for normal infectious diseases, we are more than capable of, facing any kind of onslaught. People like us who did not have one single facility for testing for COVID, introduced it in 20 different labs, and I'm sure SRL has also done that. So we will always rise to the occasion, and as far, if it is not a pandemic, I think we'll be able to control it.
Mr. Anand? Very briefly.
I think the capacity has definitely increased in terms of infectious disease testing because of all the COVID labs that have been created across the country by all the large players, as well as by the 2,500 odd labs which have been registered. What is more important to know is that infectious diseases is there to stay. So we have about 66 million people who have been diagnosed and treated for tuberculosis in the last 20 years. And hepatitis B and C is a big concern, where you have about 300 million people who are positive across the world. And 9 out of 10 people who are positive, they don't know that they are positive. So that is the kind of situation that we have. So focus is very important on infectious diseases. And I think COVID has given us a push in terms of increasing our decentralized testing for infectious diseases as well. But more importantly, I would like to emphasize that when you talk about new variants and new viruses coming up, we should look at more on lab-developed assays for testing, so which will help us, catch the right variant at the right time, rather than just looking for FDA-approved kits to be used everywhere.
Lab-developed kits, not looking at outside kits, you're saying?
Yes, lab-developed assays.
Okay, I see, okay.
Yeah.
Mr. Antony and Mr. Prashant?
Yeah.
Very quickly, and
yes,
then...
Yes. Nothing more to add on the lab part of it, because you have the experts here who just spoke, and I completely agree with him. I'll just add one thing from an e-health point of view is with e-health and with the access, in our case, for 30 years plus, high quality and high quantity of data available, the use of machine learning and AI in terms of understanding what has worked, what has not worked, is second to none anywhere in the world. So we believe, and that's an area which we haven't actually focused in this discussion, but we believe that that is also going to help us, help the entire the healthcare industry in managing some of the known and unknown issues of infectious disease.
For a long time, we've been talking of point-of-care devices and diagnosis. I think for infectious diseases, now we are seeing much more miniaturization and technology is advancing. Finally, we might see that sector take off, and that is for broad-based approximate testing in that sense. The other is, I think we have a huge infrastructure of molecular diagnostics that got set up and stabilized thanks to the pandemic. And now going ahead for the infectious diseases, I think that will come more into play than before, given the kinds of variants. And today you have fever, you really don't know what is going on because so many exotic viruses are out there. And molecular diagnostics, I think, is an asset and infrastructure that is now good to go, available, and it will be used more and more.
Yeah. All right. Last, just one sentence each. Actually, just quick point on the pricing part. Given the kind of lifestyle that people have, many of them will keep going for lipid profile test. What's 700 rupees? Is that what the test will be? What's the sense? Are the current prices reasonable, or do you
see? I'll answer this question.
Very briefly, subject. We run out of time.
So the question is not 700 rupees or 100 rupees. If they find it lucrative still to do it in 100 rupees, it's perfectly all right by us. Point I'm trying to make is that there has to be differential pricing in this sector all the time. We've been telling this to the government. The government has, in principle, agreed. So yes, according to the qualities which you offer, well, a test can be, rated at 1,000 rupees, 500 rupees, 50 rupees, etc., etc. but there will be differential pricing just like the Indian railways. The train moves from point A to point B. But is everybody paying the same fare? Unreserved second class is the lowest, first class first is the highest. And the train is moving from a point A to a point B. Thank you.
Mr. Anand, I'm referring only to point A only, Delhi, here only. I just want to get the test done. Differential pricing, not across income categories or so. There is differential pricing happening at this point of time. Current prices, are they reasonable? Or they'll stabilize at this, or will we see further disruption?
First, the current prices are definitely reasonable. There will definitely be differential pricing in the markets because there are different formats. As Dr. Lal pointed out, we are not just talking about giving a report, we are talking about providing a service around that. So based on what kind of service, what kind of infrastructure that is there, so there will be differential pricing. Whether you go to a hospital, it will be different. When you go to a clinic, it will be different. When you go to a standalone laboratory, it will be different. When you go to an integrated diagnostic center, it will be different. So differential pricing is here to stay, and people understand it. So for all we say about pricing, this industry, this requirement of diagnostics is not really price sensitive. It's more about quality, it's more about convenience and service.
Okay. So, any thought from both of you? We've concluded actually. If any thought?
Just that I think over the long term we'll move much more to value-based care, and that's where digital technologies, again, what was mentioned earlier, much more integrated, omni-channel life cycle care models will come, and that's where the pricing comes in the overall context of the care. That's where we'll move. In the medium term, I think we'll keep seeing a lot more activity because this space has a lot more players, a lot more investment, and a huge pool of patients who need to be diagnosed. So we will see pricing models continue to innovate, and I think across the board, it's a service industry, it's not a commodity industry. So a pizza can cost 100, 200, 500. It all depends on what customer you are serving.
Mr. Prashant, you would have got, I think, the ultimate that you wanted, you got here because all the others have said differential pricing is fine. So I think you can continue with your advertisements.
But that was never in a doubt. I think it will be always, it has always been. It's a service industry and not a commodity product industry.
Can I just make one last point? This digitization of the industry is not what will bring the prices down. Digitization we have been doing since 1986. We're the first people to introduce computers in this industry. Point I'm trying to make is that there is something beyond digitization. There is a patient, there is a test, there is an HLA test. The chap is dying of kidney disease, ischemic heart disease, etc., etc.
Yeah.
So those tests whose prices have been brought down, by and large, they are highly, highly automated.
Okay.
And in many countries, I don't want to name the countries, you are only allowed to charge for the first 3 or 4 tests which you write because it's all insurance based. The next 5 or 10 tests have to be done free.
Okay.
So this is what digitization or automation brings. Thank you.
Okay, thanks. Thank you so much. I think we've just run out of time. So thanks so much again.